Hi, I'm Dr. Marlene Dietrich. Today we're going to be spending some time talking about sleep apnea in this online presentation. Sleep apnea is a disorder in which patient exhibits pauses in breathing at night while sleeping. In order to count as a sleep apnea, the pause has to be at least 10 seconds. There are people that have central sleep apnea, which is not going to be the focus of today's talk. We're going to talk about problems that cause obstruction in airway flow during the night that lead to obstructive apneas. There's a diagram on this slide that demonstrates the tissues in the upper airway that can be involved by sleep apnea. These include the tonsils, the tissues in the upper airway, the uvula, and the tongue. Sometimes these tissues can be enlarged, or they can be weak or floppy during sleep, and that can cause the airway to collapse, which results in a sleep apnea. Sleep apneas result in drops in blood sugar saturation, and that can put a strain on the heart and contribute to other problems such as high blood pressure and other health conditions. Sleep apnea affects about 18 million Americans. People that are more likely to get apnea are mostly middle-aged men. That's the sort of classic picture of a person with apnea, someone who is obese and primarily the middle-aged man. People that are also at risk are women who are pregnant and women who have gone through menopause. Sometimes children can get sleep apnea as well. When a child is snoring, it's not really just a funny thing to watch. It's actually a serious condition, unless they just have a cold or some temporary condition. When a child is snoring, and especially if they're not doing well in school or they seem very tired during the day, they may actually have sleep apnea. We know that certain populations are also more prone to apnea, and those include smokers, and actually African Americans are more likely to be affected by apnea than Caucasians or Hispanics. People with sleep apnea can present with a variety of symptoms. The most common one is probably sleepiness during the day or fatigue. People often feel like they've gotten a lot of sleep at night, but they're tired when they get up in the morning, which is unusual. People that snore a lot at night or exhibit snorting or gasping are at a higher risk for sleep apnea. Often it's not the patient, it may be the spouse or bed partner that notices that and asks the patient to come in for an evaluation because they're not getting any sleep and the patient is not getting any sleep. The spouse or bed partner might actually be awake at night and watching to make sure that the patient takes the next breath and even giving them the elbow or shaking them to make sure that they start to breathe again. People that have headaches in the morning are sometimes people with sleep apnea. Men with sleep apnea can have erectile dysfunction. People with apnea often are irritable and they might actually have a worsened depression. And people often have difficulty concentrating during the day. This also applies to children who are having trouble in school and might actually be suffering from sleep apnea. People with apnea have many different medical conditions. The most common one is probably high blood pressure. Patients often also have cardiac problems, and the three main cardiac issues that can come up are cardiac dysrhythmia, such as atrial fibrillation. They are at higher risk for heart attack. They're at higher risk for congestive heart failure and something known as right heart failure. And there is also a higher risk of stroke in patients with sleep apnea. Conversely, people that have strokes are also at higher risk of developing apnea. We know that people with apnea have a higher risk of diabetes and metabolic syndrome. They can also just have glucose intolerance, which can be a pre-diabetic state. Metabolic syndrome refers to people with type 2 diabetes or glucose intolerance or even what's called insulin resistance. And also central obesity, which is obesity that affects the mid-portion of the body more, and they have hyperlipidemia or high triglycerides. That combination of factors is known as metabolic syndrome, and there's a higher increase of that with sleep apnea. Sleep apnea can also contribute to worsening obesity. People with apnea often are too tired to exercise. They might also be eating the wrong things. In another online course, we'll be talking about a closer association between apnea and metabolic disorders. And we know that people sometimes when they're overtired will eat high carbohydrate or high calorie foods, and that can contribute to the obesity. There's also hormonal changes that can occur, which we'll discuss on another program. People that have apnea or other reasons for sleep deprivation are at a higher risk for accidents, and one of the major concerns there is the risk of car accidents. There have been some rather notorious and tragic accidents that have been described as a result of people that are sleep deprived. One of those would be the Exxon Valdez tragedy, and there have been some airplane crashes attributed to sleep deprivation as well. People that are affected by apnea not only are sleepy because of the apnea, but a lot of it probably is due to the deprivation of sleep that results from the apneas. People with apnea are at a higher risk of accidents at home and at work. This is becoming an increasing concern in people that have jobs that require a lot of vigilance, such as truck drivers and people that operate heavy machinery. Some employers are now asking people to be screened for sleep apnea to reduce the risk of accidents in the workplace, and in some cases they're requiring that the person be treated for their apnea before they can continue to work there. If you think you have sleep apnea, or your spouse or bed partner thinks you have sleep apnea, there are several things that can be done. The first thing would be to discuss it with your doctor and determine whether you need to have a sleep study done. If you're referred for a sleep study, this would involve coming and spending a night in the sleep lab and sometimes staying over into the next day to determine some additional factors that might be at work during the day. A sleep study involves looking at sleep efficiency, which is what percentage of time a person in bed is actually sleeping. We also look at the stages of sleep that a person is in, which involves brainwave activity assessment, and that's done by looking at recordings from electrodes on the head. We look at a person's respiratory effort, which is gauged by some stretchy belts that go around the body and show us the effort of breathing. We also look at body position, as many people have apnea that is really confined mostly to one sleeping position. It's common to have sleep apnea worst when a person is sleeping on their back, and sometimes people have already figured that out because they tell me that their spouse only lets them sleep on their side, and when they get on their back they snore and have apneas, and they don't get to stay in that position very long. We also look at oxygen levels during the night. We look at heart rate, and we try to make sure that there are no heart rhythm issues that are associated with sleep apnea events. We look at how much snoring is going on, and we also look for other behaviors that might be occurring during the night. If a person is diagnosed with sleep apnea, or even if you think you have sleep apnea, there are certain steps you can take to try to reduce that. One type of intervention would be things you can do on your own, including losing weight. People with apnea are by and large more prone to obesity, and so losing weight can have a very positive impact on the presence of apnea. Unfortunately, sometimes that takes quite a long time, and so people require other interventions in the meantime. We advise people to avoid drinking alcohol late in the day. Alcohol tends to make people a bit sleepy at night, and sometimes people use it to help them get to sleep. Often that works, but it may backfire during the night, and a person may have a lot of nighttime awakenings as a result. People often have discovered already by the time we see them that they are better off sleeping on their side, so that is certainly something worth trying if you think you have apnea. If you are diagnosed with apnea and these lifestyle interventions are not adequate, then the usual first-line treatment would be CPAP, which means continuous positive airway pressure. That involves using a mask of some type to deliver some air pressure to keep the airway open at night. There are several different types of masks. One type is called a nasal pillow, which fits in the nose. There's also a nasal mask, which just goes over the nose. And then for people that are mouth breathers, we sometimes need to use a full face mask, which covers the nose and the mouth. That is a good first-line treatment for all types and severity of apnea. If a person has just mild or moderate apnea, or they don't feel they can use CPAP, sometimes they are a candidate for a dental appliance. And what that involves is a custom-made device that is made by a dentist who's trained to do so. And the purpose of that is to reposition the lower jaw and sometimes the tongue to try to create an open airway during the night. Last resort treatment would be a surgical intervention, which we don't recommend early on usually. That is something that is, of course, not reversible, sometimes can have complications and doesn't always cure the problem, but there are some select individuals in which that really is the only thing that may work for them. So if you think you have sleep apnea, the best thing to do is find a way to get it treated. Treatment is very important because not only will you feel better, it can also improve your health in other ways and, of course, make your spouse happy. So if you think you have a sleep disorder, you can check out some links on the hospital websites and look at the other programs that we have geared towards sleep education. Your doctor can do an initial evaluation, and he or she may choose to send you to a sleep specialist for a more sophisticated or detailed evaluation. And we hope this helps you get a better night's sleep.